Hi, Mrs. Morris. How are you?
Okay.
My name's Mitchell. I'm going to be your vital signs tech.
And I'm Jen. I'm your student nurse today. How are you
Hi.
doing?
Oh, not great. I'm
Not
having
good?
trouble catching my breath.
Okay. Well, I'm gonna raise your head of bed a little bit because you're flat, so maybe this will help you breathe a little bit easier.
Okay.
Alright.
I'm going to place this pulse ox on your finger. This is going to pick up your oxygen reading.
Okay.
Let's see what we're at. Have you been wearing this nasal cannula? I see it was sitting right beside you.
Oh, I forgot to put it back on after I went to the bathroom. I'm sorry.
Oh, no worries.
okay.
Don't be sorry. I'll get that on for you right now. Alrighty. Alright, so we're at 90 right now, which is still a little low. I'm going to increase it up to 6. You might feel a little bit more oxygen going through. Alright, is that helping at all?
Maybe a little bit.
A little bit? Okay. We're gonna start our assessment, and if your oxygen doesn't improve, we'll just we'll get you into a different respiratory device. Okay? Put you on a face mask. All right. So I'm gonna listen to your heart and lung sounds. Is it okay if I listen under your gown?
Sure.
Okay.
Thank you for asking.
And then before that, can you tell me your name and date of birth, please?
My name is Marge Morris. My birthday is June 6th, 1989.
All right. Awesome. Okay.
Alright.
Okay. Just underneath your gown.
I'm going to take your temperature real quick. Go ahead and open up your mouth and lift up your tongue.
Okay.
And then can you take a deeper breath than normal? No, it might be hard.
Perfect. 98.5.
I'm gonna listen to your heart.
Take your blood pressure.
All right. And then I'm gonna listen to your belly sounds, okay?
Okay.
Whenever you get a chance, we're gonna listen to the back of your lungs on the back. So I'm gonna have him help us kind of lift you up a little bit, okay?
Okay.
All right.
1, 2, 3.
Good job. You okay?
I got you.
All right. Again, some deeper breaths, please. All right.
Alright, I'm going to sit you back
I'm gonna
down.
lay you back down.
Okay, good.
So you're still around 89 to 90, even with that increase of oxygen. So I'm just gonna go ahead and put that face mask on you, okay?
Oh, okay. Am I okay?
Yeah, it's just your oxygen is a little bit lower, and sometimes you just need a different device just to give you some more oxygen. The max with the
Okay.
nasal cannula is 6, so we're gonna give you a little bit more.
Okay.
All right. Take this off here real quick. All right. So are you from around here?
Yep. I grew up in Pittsburgh.
Oh, that's exciting.
How about you?
I'm actually from out of town. I live about 2 hours away, so a little bit different living in the city. Alright, so we'll put this on you. This is gonna kind of encompass your face a little bit, but it will deliver a little bit more oxygen for you. Alrighty, and then I'm just gonna continue with my assessment, alright? Gonna feel your pulses. Have you been coughing or deep breathing at all?
Well, I've been coughing just because of the bronchitis.
Okay, have you been coughing anything up?
A little bit.
A little bit? Okay. Some things that can help you kind of breathe a little bit more. If you are coughing stuff up, we really definitely want to promote that. So if you can, try to cough as much as you can, get that stuff up and loose so it's not sitting in your lungs. What we can do is we can teach you a cough and deep breathe exercise. So you would cough and then like do a couple deep breathes and then go ahead and cough again. It helps really kind of project that stuff up so it's not stinging your lungs.
Okay, I'll try that.
Yeah, do you want to try it right now so that we can watch you?
Sure.
Alrighty. Go right ahead when you're ready. Good job! Awesome. Alright, and what were her respirations?
She was a little higher, like maybe like 18.
Okay, that's fair. Alright, so I'm done with my assessment, but I'm just gonna stay around and watch you a little bit. Your oxygen improved to 94, which is great. It's definitely better than the 89 that it was. We're just gonna keep on kind of reassessing you, alright?
Okay.
Alright, and then I'm gonna give you your call bell in case I forget in the future. Definitely we want you to have this.
Thank
okay?
you.
Alright.
Okay, so let's talk about how this simulation went. First of all, what did you learn? What do you think went well?
So we walked in and our patient, we knew that we had to do a head to toe assessment, and we walked in and she started complaining about her respiratory. So we immediately looked at the respiratory. We sat her up in bed, we put her nasal cannula back on, we increased it, and we noticed that it wasn't, her SpO2 wasn't getting any higher. So then we eventually put on the face mask while still getting the head to toe assessment. So.
How about you? What did you learn from this one?
Definitely like that whenever there's an issue with your patient that like they're like specifically requesting, like she at that moment she could feel herself like struggling to breathe, and like all your cues kind of aligned to like, all right, there's an immediate issue that needs addressed. And I felt like we were able to capture that, act on it, and also stay with her afterwards to continue assessments and
And I feel like we worked well together because he was still getting his vitals as I was still assessing, and then when he was like kind of in between, I had him like help lift the patient so I could listen to her lungs and back just to make sure to get an overall assessment. So
Yeah.
I feel like we worked well with the patient, worked well with each other, and just like worked together.
Yep, I agree. You guys work together as a team really nicely. I also noticed, and I agree with your prioritization. Patient told you had a problem, and you addressed that problem. Were you conscious about thinking through those priorities?
So walking in, I immediately knew that there was like something, we were gonna have to change some stuff because she was laying flat. So we were like, I was thinking like, what could we do at this moment that would help her the most? So we like got her up, put the nasal cannula back on, and then we kept reassessing like, is this working? Is this working? And
Right.
thinking ahead, like, do we need to give her something else that might work a little bit better? And then we also provided some teaching to try to like improve her breathing, like coughing and deep breathing and stuff. So I think we looked in the moment, but then thought in the future.
Yep. I noticed that you asked her if she had been doing any coughing or deep breathing. And then when she wasn't sure about that, she just said that she was just doing it because of the bronchitis.
Yeah.
That you actually went ahead and taught her how to do that and stayed with her while she did.
Yeah.
I think that had a really good positive outcome for her.
I mean, if anything out of that I could have done better was just like telling her how often she should cough and deep breathe.
Oh, yeah.
But definitely
Good catch.
like teaching her it to begin with was like better. So.
Yep. Anything that that you would do differently, or anything that's unclear for you about this simulation?
No, I felt pretty good about this. So the simulation, I felt like prepared, and like when I walked in there, like we both worked together. So like it wasn't just one of us kind of like trying to do it all.
Right.
So I felt prepared and everything.
Okay. Anything unclear for you?
I don't think so. I think just something to like put in my mind, like make sure that like when you teach effectively, like the patient's able to help herself or himself like afterwards that you left. Like in that moment we were able to stay with her and provide like continual like assessments. But at the end of the day she's gonna know how to help herself, or she'll have the call bite and be educated on how to help herself should that happen again.
Okay, great.
My only question would be like, when would it be okay to leave? Because we did stay with the patient
okay.
because we were making sure that we were reassessing that she was still like around the 90s, 94 area, even with the face mask. So like, when would it be okay to leave and everything?
Okay, great question. When you feel like she's stabilized and that her O2 saturation has stayed in the prescribed range for maybe 5 to 10 minutes, and that your patient isn't feeling anxious, they're feeling comfortable.
Okay.
That's usually a sign that their respiratory rate and status is pretty much under control.
Okay.
Okay.